Unfortunately, there are many diseases that we treat as physicians which are incurable. I'm an oncologist, so obviously many of my patients have cancer that I can't cure. When I have patients that I can't cure, one of the most important conversations that I have with them is, what are we going to do as we approach the end of your life? This is a very uncomfortable area for many patients and their families, but unfortunately it's very uncomfortable for many physicians as well. There are recent data that show that only 40% of people who die from cancer have had an end-of-life discussion with their oncologist before they die. To me, this is a huge problem. There is one opportunity to increase the quality of your life as you reach its end, and that can only occur if you've had the discussion with your doctor. I suggest to all patients and their families that they shouldn't fear that discussion, and if the doctor isn't bringing it up, they should bring it up to the physician. Many patients and their families fear that if you're talking about end of life, that means you've given up. I don't agree with that sentiment at all. I think that some of my patients who face death from cancer have had extremely great experiences in the last months of their life that they wouldn't have had if they and their families hadn't acknowledged that the end was coming. It is something where there is actual research data that show that patients have a better quality of life in the time preceding their death if they had intentionally talked about end-of-life issues with their doctor and their families before their death happened. If you fail to have an end-of-life discussion with your physician, you may be also failing to have access to some of the things that can really improve the quality of your life, like access to palliative care. And by palliative care, I mean care that's directed exclusively at relieving your symptoms. Some of the symptoms that you may be experiencing are pain, shortness of breath, anxiety, depression, worries about financial issues of your family. It goes on and on and on. Believe it or not, for all of those areas that I've just mentioned, there are professional people within our system that can help you address them. All you have to do is have the discussion. One important issue is a do not resuscitate order. This is an issue that's there's a lot of misconception about in our society. Simply stated, a do not resuscitate order is an order in advance that says if your heart stops or your breathing stops, it defines your wishes of how you want that managed. We have all kinds of technology available to us to restart hearts and restart breathings, but factually, they're not for everyone. If you have a terminal disease, if you're elderly, if you have many other health problems, the chance that you're going to survive the hospitalization if you have a cardiac arrest is not that great. If you have an end-of-life issue that you've already thought about with your patient, with your family and your physicians, maybe you don't want to go through those things. Maybe it causes more suffering in some issues. The only way to make sure that your wishes are known is to have the discussion with your physician. When you're admitted to the hospital for a serious illness, you should speak with your doctor about what you want to be done if your heart or your breathing are to stop. Many patients have an easy time talking about that stuff with their family, but unfortunately in my long career I've seen countless numbers of cases where people have gotten into a position where their heart has stopped or their breathing stuff and nobody knows what their patient's wishes were. This puts your family in an uncomfortable position, and it puts the healthcare team in a very difficult position as well. Your doctor is really obligated to talk to you about these things. Unfortunately, it doesn't always happen because doctors are human beings too and tend not to want to talk about things that they think will make the patient feel uncomfortable. The way that it goes the best is that you as a patient or a family member make it very clear that this is a conversation that you want to have.